Hey guys, welcome to the third part of our series of anatomical landmarks seen in IOPA. Today we are going to study about the landmarks which are seen in mandibular IOPA. There are mainly two landmarks which we have to see. The first one is the genial tubercle or mental spine. To start with this, first revise the basics. The radiolucent structures appears dark or black in color while the radio opaque structures appear white or light in color. So the genial tubercles or mental spine, as the name suggests, they are a bony structure, so they will be calcified. Calcified structures appears radio opaque or white on radiograph. So the location of genial tubercles, which are also known as mental spine, are lingual surface of the mandible. As we know, the lingual surface of the mandible has the genial tubercles above the inferior border of midline. This is our mandible. Imagine this is our mandible. Here, the genial tubercles are located. There are mainly four genial tubercles. They are nothing but bony protuberances. Protuberances are nothing but the elevation, more or less spine shape. They are right, left, superior, inferior. So, right superior, left superior, right inferior, left inferior. They appear on radiograph as radio opaque structure or radio opaque mass in midline below the central incisor roots. These are our central incisor, these are our lateral incisor. They appear below the central incisors. They appear below the central incisors, as we can see in this diagram, also as we can see in this diagram. In this IOPA we can see the radio opaque mass, also in this diagram we can see the radio opaque mass. The second structure we are going to see is nothing but lingual foramen. As the name suggests, foramen means hole. Hole contains air or air, so it will appear radiolucent as it is a type of cavity. It is a tiny opening. The lingual foramen is a tiny opening in the bone located on the lingual surface of the mandible near the midline. It is located near the midline, surrounded by genial tubercles. So, to tell the location of the lingual foramen, these are our genial tubercles and these are the lingual foramen. Lingual foramen appears radiolucent while this genial tubercle, as it is a radio opaque mass, it will appear radio opaque or white in color, while the lingual foramen will appear black or dark in color. They are located near the midline, surrounded by the genial tubercles. On the radiograph or IOPA, they will appear as small radiolucent dot. As we can see here, they will appear as a small radiolucent or black colored dot surrounded by radio opaque ring. This is a radio opaque ring, and in between we have the radiolucent structure, which is nothing but lingual foramen. It is inferior to the apices of mandibular incisors. It is located near the apices. Apices is nothing but the apex, root apex of the mandibular incisors. Now the third structure we are going to see is mental ridge. Mental ridge. Ridge is nothing but a bony prominence. So how it will appear? Radio opaque or radiolucent? Radio opaque. So the location of the mental ridge is linear prominence of cortical bone. There are different types of bones which make our mandible or maxilla. The linear prominence of the cortical bone is known as mental ridge. It is located on the external surface of anterior surface of mandible. As we know, this is our mandible and we are seeing the sagittal section of the mandible. This is our external surface or anterior surface, external surface of anterior surface of mandible. So this was our sagittal section, and this we are seeing the mandible from front. Here, somewhat here, it is located. This is our mental ridge. How it appears? It appears a inverted V shape. How it appears? As inverted V shape, slope slightly upward in the premolar region to midline. From where to where? From midline to premolar region. From midline to premolar region. It is located on the external surface, that is bahar wala surface of anterior surface or anterior part of the mandible. On the radiograph or on the IOPA, we can see two radio opaque lines sweeping bilaterally. How they are? They are bilateral. Bilateral means they will occur on both sides, forward and upward. Forward, and they are going upward. How they are going? Forward and upward. Forward and upward towards the midline. towards the midline. The V's apex is towards the midline. It appears as an inverted V-shaped manner. As we can see, inverted V, inverted V, inverted V, forward and upward. This was about the mental ridge. The next structure is mental fossa. Mental fossa is nothing but, fossa means depression, depressed area of bone. It is located in the labial aspect of mandible. Where it is located? Labial. Labial means lip side. So labial and lingual aspect, we know it is located near the lip side of the mandible. Laterally from midline. Where it is located? Laterally from the midline, above the mental ridge. This was our mental ridge, inverted V shape. Here, somewhat here, this fossa, as we can see some depressed structures, this is known as mental fossa. This is known as mental fossa. It appears radiolucent. Any depression appears radiolucent above the mental ridge. Where it is located? Above or below? Above the mental ridge. Lower border of mandible, as the name suggests, as it is a lower border of mandible. Mandible is nothing but a bony structure, calcified structure, so it will appear as a radio opaque on the radiograph. As we know, this is our mandible. These are nothing but condylar process and coronoid process. So this lower border of mandible, how it will appear? As a radio opaque band. As we can see in this IOPA, this one is our lower border of mandible, and in this IOPA, lower border of mandible. The next structure is the mental foramen. As the name suggests, foramen. So how it will appear? Yes, correct. It will appear as radiolucent structure. Where the location is anterior limit of inferior dental canal. As we know from the anatomy, there is a canal which is coming here. So the anterior limit means frontal, limit means where it ends. So the anterior limit of dental canal, inferior alveolar canal or inferior dental canal, is the mental foramen. It is located on the external surface of mandible. The point to be noted, it is located on the external surface, not on the internal surface. The region of mandibular premolar. So if I will ask which are the anatomical landmarks you will see in mandibular premolar region, mental foramen. How it will appear on the radiograph? It will appear as a small radiolucency in the apical region of mandibular second premolar. These are our lateral incisor, central incisor, lateral incisor, canine, first premolar, second premolar, in the apical region, of the mandibular second premolar. Now the next structure we are going to see is nutrient canal. As the name suggests, it is nothing but a tube-like passage. Canal will appear how on the radiograph? As we know, it is a hollow structure. Hollow structures appear as, yes, correct. It appears as radiolucent lines through bone. It contains nerves and blood vessels and supply the teeth. They are vertical canals. These are the vertical canals. The point to be noted is the nutrient canals are the vertical canals. Downward from the apex. Downward from the apex. As we can see here, this is the nutrient canal. This is the nutrient canal going downward from the apex. Now the next structure is the mylohyoid ridge. As the name suggests, it is telling ridge. Ridge will appear, ridge is a bony part. So how it will appear? Yes, correct. It will appear as a radio opaque band. This is mylohyoid ridge. This white structure, as you can see, this is the mylohyoid ridge. It is nothing but irregular prominence of bone located on the lingual surface of the mandible. On the external surface, what was located? Mental foramen. But the mylohyoid is located on the lingual surface. It is located at the area of third molar to lower border of mandible. Region of chin, from where it starts, from third molar to lower border of mandible, in the region of chin. This is our face. This area, from here it comes towards the chin area. Okay. Attachment for mylohyoid muscle. Why mylohyoid ridge is present? As the name suggests, it gives the attachment for the mylohyoid muscle. On the radiograph, how we can see, as it is a ridge, it will appear as a radio opaque band, extends downward and forward. How it is going? Downward and towards the forward direction, where it is going forward or frontal direction. Area of third molar to premolar, level of apices of posterior teeth, where the apex are located on the of the posterior teeth. It runs from there. So this was about the mylohyoid ridge. The most important point is it is located on the lingual surface of mandible. To see is the mandibular canal. As the name suggests, canal is nothing but a hollow passage. So how it will appear on the IOPA? It will appear correct. It will appear as radiolucent area. But as it is a canal, the linings of the canals, how it will appear? It will appear as radio opaque. Two radio opaque lines. It will be below the mylohyoid lines. It will be below the mylohyoid lines. So the location is of the mandibular canal is tube-like passage. It carries inferior alveolar nerves and vessels. What are the contents of the mandibular canal? Inferior alveolar nerves and vessels. On the radiograph, it appears radiolucent. The two lines which are running parallel, therefore they are known as tramlines. They appears radio opaque below the mylohyoid lines. The next structure we are going to see is external oblique ridge. External oblique ridge, as the name suggests, ridge. So how it will be? It will be a bony prominence. So how it will appear? As radio opaque. Very good. So it is nothing but continuation of anterior border of ramus of mandible. As we know, this is the ramus, if condylar coronoid process. So this is the anterior border. This part is the anterior border of the ramus of mandible. So the external oblique ridge is continuation with the external oblique ridge is continuation with the anterior border of ramus of mandible. There are there are three parts of the mandible. There are mainly three parts of the mandible. This part is known as ramus. This is the angle of mandible, while this is the body of mandible. So the external oblique ridge is the continuation of the anterior border of ramus of the mandible. How it will appear on the IOPA or radiograph? Radio opaque line. Very nice. Of varying width. It's not necessary it will be of same width. It can be of varying width. And it is located posterior to the third molar area. It is located posterior to the third molar area. As we can see in this diagram, it is located posterior to the third molar area. The next structure is the submandibular. Name suggests fossa. So it is a depression. How it will appear? As a radiolucent area. Very simple. Depression, internal surface of mandible. The point to be noted, the submandibular gland is a salivary gland. It is located in the internal side of the mandible. So the fossa will also be on the internal side of the mandible. It is a depression located on the internal side of mandible or surface of mandible, inferior to the mylohyoid ridge. It is located below the mylohyoid ridge. Submandibular fossa is located below the mylohyoid ridge. Submandibular glands lies on this. It's very simple. So on radiograph, how it will appear? It is located below the mylohyoid ridge and it appears as a radiolucent area. As we can see here, depression or fossa, this structure, this is nothing but the submandibular fossa. It occurs below the mylohyoid ridge. We saw the mylohyoid ridge is also located on the lingual or internal surface of the mandible. The last structure for today is the inferior border of mandible. As the name suggests and we have discussed earlier, it is a broad radio opaque band of bone. It is a broad radio opaque band of bone. So this was all about the structures seen in mandibular IOPA. To summarize, in the mandible, in the incisor and canine region, in the mandible, in the incisor or canine region or anterior region, the radiolucent structures seen are nutrient canal, which were vertical, lingual foramen, which was located in the middle, around was the genial tubercles. How it will appear? Radiolucent. Genial tubercle will appear radio opaque, and the mental fossa. These were the radiolucent structures, while the radio opaque structures were mental ridge, that V-shaped inverted ridge, genial tubercle or mental spine, inferior border of lower mandible. This inferior border of lower mandible. These were the radio opaque structure seen in the anterior region, while in the premolar region the radiolucent structure are the mental foramen and the mandibular canal, and the radio opaque structure is the mylohyoid ridge. As the name suggests, ridge means bony structure, so it will appear radiopaque. Canal means hollow structure, so it will appear as mandibular canal. As we have seen in the mandibular canal, there are two lines which appear as tram or parallel lines, so they are known as tram lines. And what they carry? Mandibular canals carry inferior alveolar nerves and vessels. What the mandibular canal carries inferior alveolar nerves and vessels. And the next structure we can see in the molar region, the radiolucent structure is the mandibular canal, or that is the continuation from premolar to molar region, and the submandibular fossa. Fossa means depression, so it will appear as radiolucent. The radiopaque structures are external oblique ridge, as the name suggests it is a part of bone, so it will appear radiopaque. Borders of the mandibular canal, that are the tram lines, and inferior border of mandible, obviously it will also appear radiopaque. And the internal oblique ridge, how the internal oblique ridge will appear? It will also appear as radiopaque. So this was all about the landmarks seen in IOPA. Thank you. Keep watching.